morning mga kasambahay! Welcome to Dr. UNTV. I'm your host, Dr. Barba-Cabodil. Let's rise and shine to a day filled with health, positivity, and all things well-being. At bago po tayo dumako sa ating talakayan, ako nais naming magbigay diin sa kahalagahan po ng awareness sa mga issue tungkol sa kababaihan. Ang pagiging babae ay may kaakibat na hamon, kaya't layunin naming magbahagi ng mga payo upang mapanatili ang kalusugan ng woman's reproductive system. Para po sa detalye, panoorin natin ito.
Hello mga kasambahay, I'm Dr. Steph Supan, an obstetrician gynecologist. Welcome to Women's Health. Ang pag-uusapan natin ngayon ay napaka-importante at ito ay tungkol sa reproductive system ng isang babae. Ang reproductive system ng babae ay much more than just ang matres at ang ovaryo. Ito ay napaka-complex at kailangan nating maintindihan kung paano ito gumagana para mapanatili natin itong malusog. Paano nga ba natin mapapanatiling healthy ang ating reproductive system para makaiwas sa mga life-threatening diseases? Let's start our discussion now. Ang reproductive organs ng babae ay composed ng matres, ovaryo, at ng mga hormones na nagpapatakbo nito. So, ang main function nito ay hindi lamang bahay bata o para magkaroon ng isang anak. Ang hormones ng babae ay nakakaapekto sa buong katawan ng isang babae. Paano nga ba gumagana ang ating reproductive system? Para sa mga kabataan, ang kanilang reproductive system ay hindi pa mature. Ito ay nagmamature simula ng kanilang unang regla. It takes mga 2 years bago ito tuluyang maging mature. Sa unang 2 taon ng mga babae na nagme-mens, ay hindi pa talaga regular ang kanilang reproductive system or menstrual cycle. So natural lamang na hindi pa regular ang kanilang menstruation. After 2 years ay dapat maging regular na ito. Kaya para sa mga babaeng hindi pa regular ang mens after 2 years, kailangan kayong magpa-check up. Ang regular na pagme-mens involves a lot of things. Ang hormones para mag-menstruate tayo ay galing sa ovaryo. Habang lumalaki o nagmamature ang eggs ng isang babae sa kanyang ovaryo, nagpo-produce ito ng hormones, mainly estrogen, para kumapal ang lining ng matres. Ang lining na ito ay kung saan nag-i-implant ang isang embryo kapag nabuntis ang isang babae. Kapag siya ay hindi nabuntis, ito naman ay mag-shed as menstruation. Ang pagme-mens ng isang babae ay naguhudyat sa ating brain na mag-produce ng hormones para sabihan ng ating ovaryo na mag-produce ulit ng itlog. Ito ay nangyayari paulit-ulit at ito ang nagka-create ng isang menstrual cycle ng isang babae. Dahil maraming organs ang involved sa menstrual cycle ng babae, ay minsan nagkakaroon din ng tinatawag na hormonal imbalance na lumalabas as irregular menses sa ating mga babae. Ang tamang lakas ng menstruation ay gumagamit ng 1 to 5 pads per day. Ang labis na pagdidysmenorrhea o pagsakit ng puson during menstruation ay dapat ding pagtuunan ng pansin. Pag may napansin kayong irregularidad sa iyong menstruation or sobrang sakit ang inyong dysmenorrhea, kailangan kayong magpokonsulta sa inyong doktor. Ngayon na nasabi ko na kung paano ang normal menstrual cycle, isang magandang habit ay to keep a menstrual tracker. Maari ninyong ilista ang unang araw ng inyong mga dalaw sa isang notebook o kaya sa isang app sa inyong mga cellphone. Doon ay makikita natin kung gaano kayo ka-regular. Ang ating mga hormones are interrelated. Kaya ang isang bagay pa na dapat ninyong gawin to keep your reproductive system healthy ay to maintain a normal body weight. Kapag ang isang babae or under, walang specific products na maaaring i-recommend dahil ang mga ito ay depende sa hiyang ng isang babae. Maaaring gumamit ng ordinaryong sabon or mga feminine wash, depende sa inyong gusto. Pagdating naman sa mga menstrual pads, ay depende din sa lakas at ang paggamit naman ng menstrual pads ay depende sa lakas ng inyong menstruation at preference. Pag-usapan naman natin ngayon ang mga myths na konektado sa ating menstrual cycle. Ang menstrual blood, although hindi ito madumi kagaya ng pinaniniwalaan ng ibang tao, ay hindi dapat nating ipanghilamos at wala itong epekto sa acne or pimples ng isang babae. May mga nagsasabi din na bawal daw maligo during menstruation. Hindi rin po namin ito nire-rekomenda. Sa katunayan, we recommend na maligo kayo araw-araw, lalo na kung kayo ay may menstruation. Marami ding mga paniniwala tungkol sa pagkain during our menstrual cycle. Sabi ng iba ay kumain daw ng maasim habang nagme-mens para maiwasan ang dysmenorrhea. Hindi po ito totoo. Walang pagkain na maaaring makabawas ng ating dysmenorrhea, pero maaari tayong mag-take ng mga pain reliever para ma-relieve tayo. Pero maaari po tayong uminom ng mga pain reliever para ma-relieve ang menstrual pain. Wala rin pong mga pagkain na maaaring magpalakas o magpahina ng ating menstruation. Ang ating mga reproductive organs ay may iba't ibang shape at posisyon. May mga babae na retroverted ang matres. Ito ay maaaring natural na pangyayari o congenital at hindi nag-work ang mga hilot para baguhin ito. Kung kayo ay may napapansin na irregularidad sa inyong menstruation or labis ang inyong dysmenorrhea tuwing kayo ay magkakaroon, maaaring magpakonsulta sa inyong mga obstetrician-gynecologist. May mga certain tests na pwedeng gawin upang kayo ay ma-check up, kagaya ng ultrasound or pap smear. And that's it mga kasambahay. Para sa mga dagdag na impormasyon, maaari ninyo po akong i-email through shsupan@gmail.com or maaari ninyo akong bisitahin sa aking mga clinic sa St. Luke's Medical Center, Quezon City, 9th floor, room 906 South, or sa Mega Clinic tuwing linggo, at maaari din kayong magkonsulta through teleconsult through carolty.com.ph. Muli, I'm Dr. Steph Supan, your obstetrician-gynecologist this morning. Palagi po nating tatandaan, lalo na para sa mga kababaihan, that our health matters. Maraming salamat mga kasambahay.
Mga kasangbahay, sana ay may natutunan kayo, and may this serve as a way to help guide you in living a healthy lifestyle. And before we delve into our main topic, we'd like to invite you to follow and subscribe to our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv, and like and subscribe to our YouTube channel. Just type www.youtube.com/UNTV News and Rescue. And you can actually send us questions po and comments sa mga pages na yan. Ako, kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Di pa tayo tapos mga kasangbahay. Naku, marami pa po tayong pag-uusapan mamaya. Yan po ay sa pagbabalik ng Doctors on TV. Welcome back mga kasangbahay! Ngayong araw ay pag-uusapan natin ang tungkol sa Polycystic Ovarian Syndrome o mas kilala na PCOS o yung iba tawag nila PCOS. At para po sa paunang impormasyon, naku, panoorin niyo po ito.
Isa ang Polycystic Ovarian Syndrome o PCOS kung tawagin ng karamihan sa pinakakaraniwang problema sa kalusugan ng mga kababaihan. Marami ang nangangarap na maging isang ina, ngunit ang nakalulungkot na katotohanan, maraming pangarap ang nanatiling pangarap dahil sa sakit na PCOS na may kaugnayan sa pagiging infertile ng isang babae. Ayon sa datos ng World Health Organization, nasa 8 to 13% ng mga kababaihan ang apektado ng kondisyong ito, at sa buong mundo, umabot na sa 70% ang mga apektadong hindi pa nasusuri o nadadiagnose. Kung ikaw ay nakararanas ng infertility o kawalan ng kakayanang magdalang tao, maiging kumonsulta muna sa isang eksperto dahil maaaring ikaw ay may PCOS na, at huwag maniwala sa mga kung ano-anong napapanood at nababasa online.
At para sa mga karagdagang detalye, in today's episode, we are delighted to have an esteemed guest. She will provide insights to a condition that demands attention, an effective approach to manage Polycystic Ovarian Syndrome. Let's extend a warm welcome Dr. Margaret Joyce Cristi-Limson, an obstetrics and gynecology specialist from Baka Medical Center. Good morning, Doc Majoy. Welcome to Doctors on TV.
Doc Sarah, thanks so much for the warm welcome and thanks for having me here. Good morning, everyone.
Yeah, it's our pleasure to have you here, Doc. No? And alam natin, this condition is very common. It's quite common and marami tayong matutulungan na ating mga kasangbahay no, sa ating tatalakayin ngayong araw. Okay, siguro, before we proceed to that condition per se, siguro maganda pag-usapan muna natin kasi we've been hearing about, naku, may issue ako sa hormones. So I have hormonal imbalance. Okay, so I mean, you would agree with me siguro pag sinabi natin na ito na muna pag-usapan natin, ano ba tong hormonal imbalance?
I agree. I think that's an excellent take-off point. Okay, so hormones, they're in our body. So sila yung nag-regulate ng systems natin. And when you say hormone imbalance, it may mean that too much or baka too little in the bloodstream. So it means that like yung langis, hindi siya yung perfect amount para patakbuhin yung mga sistema sa katawan.
And then there, nagkakagulo-gulo na.
Yes,
okay,
that's
and
right.
one would be PCOS or PCOS.
I think that's a very good example of a hormonal imbalance, Doc Sarah.
Okay, and how would you define Polycystic Ovarian Syndrome?
So, the hormonal imbalance in PCOS is when this hormone, which is called the androgen, it's actually a male hormone, okay, and that's too much in the body of a woman. So, that is Polycystic Ovary Syndrome in a simplistic description.
I see, but when we say syndrome, di ba, marami siyang components.
That is
so usually,
right.
ano po yung mga, conditions related to this syndrome?
Okay, so I think it would be apt to discuss right now kung ano ba yung mga diagnostic criteria for us to say that the patient has PCOS.
Okay.
Right. So the first manifestation will be irregular menses. Ang usual manifestation yan is yung naglalaktaw-laktaw yung regla. O kunyari, sabihin na every 2 to 3 months, no? Hindi po dinadat na ng dalaw buwan-buwan. Okay? Now, the second diagnostic criteria will be signs na mataas nga yung androgen levels clinically. So, ano ba po yung symptoms nun? Yan yung mga pasyente na may acne, daming pimples. Okay? Yung iba din po, yung mga babae, parang mabuhok, na parang sa distribution ng lalaki. So, sa likod ng legs, napakakapal dito sa tiyan. Hindi naman po masyadong ganyan sa mga babae, di ba?
Yeah.
Yung iba din po, hyperandrogenism, yung manipis na manipis yung buhok. Parang nakakalbo.
So basically, parang lalaki nga.
Yes.
But when we talk about hair,
Yes.
pero ang manifestation is sa babae.
Correct.
Na may PCOS. So that's one of the criteria.
Right. So
Okay,
that's the
and then,
second
yeah.
criteria. So hyperandrogenism. And the third criteria is yung dun po sa ultrasound. Yun po yung ultrasound na chine-check po yung mga organs dun sa loob ng katawan ng babae. Marami pong follicles sa ovaries. So more than 20 na hindi po nag-grow. So yan po yung tatlong criteria. Now, for a patient to be diagnosed as having Polycystic Ovary Syndrome, she has to fulfill at least 2 out of the 3. And that's why we say, check, may PCOS nga tong babaeng to.
And ano ba yung scary about PCOS? I mean, kasi 'di ba laging sinasabi na ko, may PCOS ako, may PCOS ako. So, I mean, what's actually scary about having PCOS?
Okay, so it is a condition that can affect your life, really. So, one is, hindi po nagre-regla buwan-buwan. So, mahirap din po magbuntis ang babae. So, a lot of patients with PCOS actually consult for infertility. So, bakit namin nare-relate yun? Kasi hindi po nangingitlog yung babae buwan-buwan.
Nang maayos.
Right.
Kasi ang dami-dami namang itlog. Okay. Doktora, siguro, can we give our viewers a background on paano ba usually pagka nagme-mens, ilan ba dapat ang itlog? How do you go about the maturation of follicle na dapat kailangan para mag-lead sa fertility yung babae?
Sige. Well, sa isang babae, may pool na po talaga ng eggs. No? A woman is born with a set pool of eggs. When she hits puberty, o nagdadalaga na po, in a month, a couple of follicles or a couple of eggs will be pulled out from that pool to develop supposedly in that month. Pero dun po yung sa pool na yan, okay, iisa po yung lalaki. So that is the dominant follicle. And mid-cycle usually, puputok po yan, tapos marirelease po yung egg. At kung meron pong sperm, mabubuntis yung babae. Pero kung wala, then the woman will get her menses usually on time. So a usual cycle will usually be about 28 days. So yun po yung normal cycle. So you just need that one follicle to be the dominant follicle. But for patients with PCOS, lahat po ng follicles, they remain small. Because yung hormone levels, instead of becoming, in this pattern that induces follicle maturation and ovulation is like in the steady state pattern. So it's always chronically small.
So marami kang follicles na wala naman talagang saysay. Basically,
Right.
hindi siya enough para mag-umpisa isang magandang itlog na ready for ovulation.
So hindi,
Okay.
correct. I like the way you put that. Parang wala silang saysay. They're just there.
Yeah, and
Yes.
sayang, 'di ba? Okay, so
That's why sa ultrasound, ang picture nila, parang maraming small follicles there, pero walang nag-grow. Kaya hirap po magbuntis yung babae, hindi ho sila nangingitlog.
I see. So now, I will lead you back dun sa mga fears o kaya yung
Alright.
mga parang downside of having PCOS. So,
Okay.
apart from infertility, what's next?
Alright, so of course, there's the manifestation of yung hyperandrogenism, which may be troublesome. For some patients, it definitely affects their self-esteem. So some patients, so it has been recorded in studies na meron po siyang effect sa kanilang mental state. So meron pong association with depression and anxiety for some
Yeah.
patients.
Okay.
Of course, there is also that association with obesity. Okay. And of course, there is also, you know, when patients do not menstruate, kung hindi po nireregla buwan-buwan, nag-worry po kaming mga OB na baka kumakapal po yung lining to a point na pwede po siyang risk factor for endometrial hyperplasia or endometrial cancer. That's why we need to regulate menses of women with anovulatory cycles, usually those women with PCOS,
Yeah.
to protect them from endometrial
Yeah,
cancer.
kasi kung nahihirapan magbuntis, so di ba we have like two major female hormones, the estrogen and progesterone.
Right.
Para sa mga viewers, ano po, naririnig natin, I'm sure familiar kayo dyan. However, pag hindi nagbubuntis, hindi nag-rise ang progesterone and laging sa estrogen exposed, okay? And
Right.
kung ganyan nahihirap magbuntis, pag kasi ang estrogen, meron silang component na parang, yun nga yung pwedeng mag-induce ng mga bukol, ganyan. And we do not want na pwede ka rin maging at risk of having either hindi lang sa di ba, sa baba na cancer, but here also sa breast, yun nga, and ovarian, saka sa matres, like just what you said. Okay, and nako, nakakalungkot naman magka-PCOS, doktora, pero eto muna, ito ba ay namamana?
Yes. Okay, so there are patients, sabihin niya yung kapatid niya may PCOS, yung nanay niya may PCOS, there may be a hereditary or genetic component to having this condition.
I see. Okay, nako. Pero ito, doktora, kanina na-mention natin, di ba, pagka may PCOS, very irregular yung kanilang menstrual cycle, di ba? Pero paano malalaman ng ating mga ng mga individuals, ng mga, like, ng mga nanonood sa atin ngayon na pagka porke ba irregular yung kanyang dalaw, yung kanyang mens, ay may PCOS na siya? I mean, I understand na-mention kayo ng criteria.
Right.
But having said that,
Irregular
basta ba
menses.
irregular yung mens, chances are PCOS na yun.
Okay, so you're talking about the chances. There is a high likelihood that the patient might have PCOS. At saka yun yung unang condition siguro at the back of our mind that we would consider. That's why yung history taking tsaka examination will be directed towards that. But not all irregular menses is PCOS.
I see. Okay, kanina, doktora, may mention kayo na usually medyo nasa heavier side, pwede rin, di ba, at risk sila of having PCOS sa ating mga kababaihan. And anong principle behind this?
Oh, okay. So now we go to the reason why patients have PCOS. So generally, the reason is not truly known, but there is a link with insulin resistance.
I see.
So when the patient is insulin resistant, then there is compensatory hyperinsulinemia or nagpo-produce yung katawan ng more insulin to be able to counteract that insulin resistance para ma-push yung sugar from the bloodstream to be used by the organs. So that becomes a problem. Obese patients are more insulin resistant. So
I see.
So that's why when we manage patients with PCOS, we try to target that.
Naku, di ba parang sinasabi pa nga gusto nga nila na parang pagka tumataas ang insulin, pumapayat. Okay, pero however, in the event na may insulin resistance, even if you have ample amount of insulin, kaso nga dahil may insulin resistance, hindi niya na-perform yung function niya. Kaya common siya sa mga matataba.
Yes,
Then,
and it also causes all the other abnormalities and the other hormones. Tumataas nga yung androgen levels kasi nagdi-decrease yung what we call sex hormone binding globulin. So all of these scientific things, no, which results to the manifestations of PCOS in our patients.
ay, sige, siguro may mga nakikita din talaga tayo na, kumbaga, hindi naman lahat ng PCOS nasa bigger, build, no?
Yeah, there's actually that phenotype, no, lean PCOS, which may be a bit more difficult to manage. Yung
Why
mga
is
medyo
that so,
payat.
doktora?
Because of course, no, the first line management for PCOS patients, especially for those who are overweight or obese, will be to lose weight. Okay? And how can you ask a lean PCOS patient to lose weight?
I see.
So it becomes a bit more tricky.
Okay. Kanina, ang dami na nating minention. So basically, ang dami-daming involvement dito sa PCOS. Kaya nga, it's a syndrome. So, Polycystic Ovarian Syndrome. Does it mean, does it suffice to say na it is not confined, this disease is not confined to the ovaries per se?
Oh, that's a very good question, Dr. Sarah. Because they think that the worst manifestation would be, kasi Polycystic Ovary Syndrome, yun yung title niya, di ba? Yun yung pangalan niya. When in fact, it's not. It's really a metabolic disease. So it's in your whole body. So kaya yung mga manifestations niya. The truth is, if I'm managing a patient with PCOS, eventually I don't really mind how the ovaries look like. It will depend on how the patient is clinically.
I see. Okay. O sige, na-mention nyo na lahat ng mga manifestations, okay, ng isang pasyente who has Polycystic Ovarian Syndrome. Okay, and syempre, pero mamaya pa natin pag-uusapan yan pagka yung mga like sa diagnosis and treatment. But what I'm interested to know would be, sa mga pasyente nyo, doktora, yung mga sinabi natin na nakakatakot, kaya naman yan? Kaya namang ma-manage?
Yes, definitely. So it can be controlled. So PCOS is something that you can control. And largely by lifestyle modification.
I see. And ang tingin ko dito, parang is primarily an endocrine problem. Pag sinabing endocrine, it has something to do with hormones. May hormone interplay, okay? And is PCOS in any way related to other endocrine organs? Like for example, the thyroid, meron ba? Kunyari may thyroid issues. So, pwede ba na it's because kaya siya may PCOS, pwedeng affected din ng iba, or like, di ba, yung pituitary gland natin, yung mga hormones kasi ng babae also, plus meron din yung some androgens that you mentioned, may kinalaman din yung ating mga stimulating hormones secreted by the pituitary gland.
So, good question. Okay, so you asked me earlier kapag lahat ba ng irregular menses PCOS?
Yeah.
So, thyroid dysfunction is one thing that we have to also rule out. So, there is maybe a close association, but they may actually coexist together. A patient may have PCOS and hyper or hypothyroidism.
It's associated to either, rather.
Yes, either. Okay,
I see.
there might be some thyroid dysfunction. Another hormonal problem that will manifest with abnormal uterine bleeding, which can also coexist with PCOS, is hyperprolactinemia. So these are some things that we see that will also coexist, not necessarily, they may be associated because all of these hormones really have a close interplay with each other.
Yeah.
So what we try to do is we will try to control each individually and hoping to get a good outcome infertility-wise, health-wise for these patients.
I agree with that, doktora. Kasi ano nga di ba pag sa hormones, one hormone really affects another.
Oh,
pag
definitely.
tumaas yung isa, magsisend ng negative feedback dun sa isa para makontrol siya and so on and so forth.
Right.
So, ganyan, no? Okay, so basically, ayan, dito na naman papasok mga kasangbahay na talagang dapat maayos yung overall health ng isang individual. In fact, doktora, when I was trying to get pregnant in 2011, dinasal ko kasi yun. I wanted to get pregnant on December 8, 2010. Not 2011, that's the year when I gave birth. 2010, okay? So, gusto ko mabuntis ng December 8, 2010. So, as early as May, I was like, mabait na. Hindi ako nagpupuyat, hindi ako umiinom ng soda, and I really prepared my body kasi naniniwala nga ako na, you have to be healthy, you have to prepare your body para dun sa, maging magandang environment for the babies. Kasi I prayed to have twins. Kaya I know na, and talagang nabuntis ako ng December 8, 2010 with twins. Yeah.
Wow!
Yeah, I really prayed for that. And pinaghandaan ko na siya. So, kaya ko lang minention, I would want to share, if I may. Kasi, yun po yung importance na yung katawan mo. Kasi di ba tayo, doktora, pag may mga pasyente na wala tayong exact number of hours of sleep, ganyan. Tapos yung food, di ba, laging delay din tayo makakain. But that time, pinirepare ko, nasal ko para mag-ayos din yung mga hormones. And of course, nagpunta rin ako sa mga doktor, okay, OBGYN, ganyan. And nakita ko, kasi may PCOS din ako
I see.
Yeah. And ang isang fear ko before was that even if I would get pregnant, hindi ba mahirap na kahit mahirap magbuntis pagka, di ba, like what you mentioned. However, pag ba nabuntis ang isang pasyente na may PCOS, how is the chance of having a miscarriage?
Oh, it is increased. Okay, so it has been documented that some pregnancy outcomes with patients with PCOS might be not as good as in a patient who doesn't have the syndrome. So, miscarriage rates, mas mataas po. So, pwede po makunan talaga yung mga pasyente. Diabetes, of course. Talagang may a predisposition to gestational diabetes mellitus, yung mga pasyente, kahit na hindi ho mataas ang sugar levels sila before sila magbuntis.
I see.
Also the hypertension, increased rate of possibly CS delivery for some of these patients if uncontrolled yung diabetes and all of these things.
Okay, so speaking of pregnancy, is it true that, pregnancy can actually correct PCOS?
Oh.
Sabi nila, di ba, doktora, naku, may PCOS ka, pag nabuntis ka, ayan, pagkatapos yan, wala ka ng PCOS. Lagi natin naririnig yun sa ibang mga patients. Is that a myth or a fact?
It is a myth. Okay? It's a myth, okay? It will come back. It can come back. Especially if you go back to your ways from before, unhealthy living, then all the manifestations might just, come out, no? Lalabas ho ulit lang yan. Mag-acne po, irregular menses, hirap na naman magbuntis, so it will come. But you know what? Fixing your lifestyle, let's say, maayos ka, then it may not come back. So it is controlled, no? PCOS is a disease that cannot be cured, but we believe that it can be controlled.
That's very nice. So, mga kasambahay, this conversation is getting more and more interesting. Naku, huwag kayong bibitiw, ha? Maya-maya po, kasi marami pa kaming pag-uusapan dito, no? Kaya, samahan niyo lamang kami at huwag ko kayong magpapalit ng channel. Doctors on TV, we'll be right back. Nagbabalik po ang Doctors on TV. Naku, pero bago po natin ipagpatuloy, panoorin muna natin ang detalye ng pasyenteng lumapit po sa ating programa. Para sa detalye, panoorin natin ito.
Nagsimula yung sintomas ko 2 years ago. New mom pa lang ako noon, tapos hirap akong makatulog sa gabi. Inaabot ako ng 1 a.m., 2 a.m. bago makatulog. Tapos, kinabukasan noon, yung mga araw na yun, laging pagod yung pakiramdam ko kahit konti lang yung ginagawa ko sa bahay. Laging mabigat yung pakiramdam ko na akala mo marami akong ginagawa, which is hindi naman. Tapos, nagsimula yung mga tigyawat ko pagkatapos. Una, pa isa-isa, dalawa. Kaso hindi sila nawawala kagaya ng dati na pag lumitaw yung isang tigyawat, mawawala. Hanggang sa dumami sila. Sa pisngi, sa noo, sa baba. Pagkatapos noon, inisip ko dahil lang siguro sa puyat, sa pagod, kaya medyo lumilitaw yung acne ko, sa stress.
Stress. Ito ang inaakalang dahilan ng lahat ng nararamdamang sintomas ni Jane, hindi niya tunay na pangalan. Sumubok siyang uminom ng vitamins, ngunit wala pa ring pagbabago sa kanyang mga iniindang kakaiba sa kanyang pangangatawan. At pati ang kanyang menstruation period ay nade-delay na rin na para sa kanyang palagay ay hindi na ito normal.
Bumili ako ng vitamins para maging okay yung pakiramdam ko. Tapos, chinek ko siya ng ilang buwan, kaso hindi siya nawawala yung ganong pakiramdam. Tapos, laging namumove tinrack ko yung period ko. Tapos, hanggang sa namumove siya ng namumove. 1 week, 2 weeks, lagi siyang delayed.
Bukod sa delayed menstruation, napapansin rin niya ang pagbilis ng pagdagdag ng kanyang timbang at ito na ang nagtulak sa kanya upang magpakonsulta na sa doktor.
Dahil doon, nag-weight gain ako. Mabilis yung pagtaas ng timbang ko, yung pagkabigat ko. And then, sinabi ko to sa mga kaibigan ko and sinuggest nila na magpa-check up ako sa OB. Which is dahil nga nakikita nila na dahil nga sa mga sintomas na sinasabi ko, baka meron akong PCOS or PCOS. Ang sabi lang sa akin ng una kong OB is mag-pills lang ako. Mag-pills lang ako and for 6 months. Kaso after nung 6 months, within yung 6 months na yun, nag-pills ako na nireseta ng OB ko, hindi pa rin siya nawawala. Nababawasan yung acne ko, nababawasan siya. Kaso yung weight gain nandun pa din. Yung cravings, yung bigat na pakiramdam, hindi nawawala. Kaya ako lumapit sa Doctors on TV kasi yung acne ko lang yung nawala. Tapos, nag-regular yung period ko, which is kapag tapos kong uminom ng pills every month, nag-regular siya. Kaso, feeling ko, hindi pa rin nawawala yung PCOS ko or hindi pa rin nababawasan yung sintomas ng PCOS ko.
For for the confirmation of her diagnosis, still here with us is Dr. Margaret Joyce Cristi-Limson, an OBGYN from Makati Medical Center, para po ibahagi sa atin ano naging test na ginawa po sa ating pasyente. Doc Majoy, ako ito, kamustahin ko, kamusta yung pasyente natin?
Okay, so itong pasyente natin pumunta sa akin kasi sinabi niya, Doc, meron ba akong hormonal problem? Kasi yun ang gusto talaga niya malaman. Sabi niya, at the back of her mind, I think alam na niya eh. Kasi parang tanong niya directly, meron ba akong parang PCOS? She manifested with acne and irregular menses.
Okay.
So, right off the bat, no? Diagnostic criteria natin.
So that's 2 out of 3.
Right. So,
nakinig ako sa lecture mo kanina, doktor.
There you go. So, 2 out
Okay.
of 3, sabihin, kailangan ko pa talaga ba ng ultrasound to tell me na may PCOS yung patient? Maybe not. Because clinically, may PCOS po siya.
I see. Okay, so that can be diagnosed also not only with what you mentioned, in the criteria that you enumerated. So pwede na yung clinical diagnosis even without having requested yet and being provided with the results ng mga ultrasound and the like. Okay.
For some patients, yes.
Okay, sa kanya. And siya ba kamusta? May asawa, may anak, and ano po yung naging history taking you sa kanya?
So, itong patient po natin, meron po siyang asawa. Actually, may anak na po siya. So, this patient did not suffer from infertility. Okay, so like I mentioned earlier, karamihan po ng mga pasyente na nakikita namin, meron pong infertility. Yan ang reason kung bakit sila nagko-consult. Tapos madadiagnose namin sila as having PCOS. Pero iba po dito sa patient na to, hindi po yan yung concern niya. Ang concern nga niya yung acne, saka yung irregular menses. So may anak na po siya. So ibig sabihin po nito, no, it's a point, na hindi ho lahat ng patients na may PCOS, hindi magkakaanak. Okay?
So that's hope.
That is definitely hope. So, but the incidence of infertility for these patients may be as high as 70%.
I see, okay. And di ba na-mention niyo may anak na? Okay, so and then basically
So I think she was okay before. I think she's 29 years old. She didn't have those complaints before. She was okay. And then when you probe deeper, you realize that she was thinner then. She started gaining weight. Then I guess the insulin resistance and compensatory hyperinsulinemia, then the manifestations of PCOS.
I see. Okay. So kaya she got to visit you. And nung nakita niyo siya, doktora, so I mean, what recommendations or after you have diagnosed her clinically and you came up with Polycystic Ovarian Syndrome, mayroon pa kayong mga ibang pina-request na mga labs?
Okay, so irregular menses was one of complaints. So definitely I will rule out thyroid dysfunction and hyperprolactinemia.
Okay.
So I checked for TSH and prolactin. I also asked for a sugar challenge test to check for insulin resistance. Some doctors would actually ask for serum insulin. Okay. Then I also checked for her cholesterol. She's a bit on the heavier side. Okay. So those will be the basic tests. Okay. Consider doing an ultrasound for these patients, okay? So those are basic things that we would probably check. But at the back of our minds, we also have to rule out any possible cause of like an androgen-secreting tumor for patients who are super hyperandrogenic. So
just
this
to rule out.
Yes, just to rule out. If you're really thinking, hey, this patient sobrang androgenic ng itsura niya. For some patients po, kalanta naman po talaga i-rule out na other source of excess androgen. So, but it will be a clinical decision for the doctor to make.
I see, okay. And sige, so basically yung mga results niya, kamusta, doktora?
I think okay naman. Basically, all her tests seem okay. So there will be no need to give her metformin, okay? The thyroid was and the prolactin levels were also normal.
But in her case, how would you manage her considering na she was diagnosed of PCOS clinically? However, I mean, based on the results that came out, normal naman.
Okay, so then
what will be your basis in managing her this time?
So we go back to the chief complaint of the patient. Ano bang nirereklamo niya? Bakit ba siya nagpakonsulta sa atin?
Basically, you mentioned that she had acne and then
irregular menses.
Irregular menses.
Okay, so overall, okay, this is something that the patients should know. The first line in management of PCOS is lifestyle modification. Okay, so it will be to bring down that insulin. Okay, improve the hormonal status in the body. So we would recommend diet and exercise, okay? They say weight loss, especially for the overweight or obese, of about 5 to 10% in 6 months. So hindi naman madali ang weight loss, eh. Kasi talagang intense. Pero they lose steam eventually, then they just go back to their old ways. So 5 to 10% weight loss in 6 months, may completely reverse or improve everything. So that is really first line. Now, depending on the problems of the patients, then we address them. Like specifically for her, I was considering giving her combined oral contraceptive pills. Why? Okay? Combined oral contraceptive pills will decrease the androgens in the body and may improve the acne and will also regularize her menses. So I'm going to hit 2 issues with 1 medication. However, one issue for this patient is she complained of headaches.
As the side effect of...
No, she has headaches.
Since when?
It's really it's something that she has.
Not secondary from the treatment?
No, she never started treatment yet. Of course...
Maybe from the hormonal imbalance, is that so?
Not sure, maybe migraine. So that's migraine headache with aura is a contraindication for pill use. So that's something that we have to explore. So I told her, you'll have to reassess this and possibly I may need clearance if I'm going to actually consider giving her combined oral contraceptive pills. If not, then we will discuss what other management we can do for her if combined oral contraceptive pills will be not a good option for her.
Yeah. However, okay, but if the patient, say for example, not this patient of ours, okay, so I'm referring dun sa ibang mga pasyente na may PCOS, doktora, okay, and gano'ng katagal usually sinasubject sa oral contraceptive pills po yung pasyente? I mean, kasi sabi nyo, hindi siya talaga totally nawawala, it keeps coming back. Does it mean na parang for life, I mean, kailangan siyang mag-take nito?
Oh, okay. Excellent question. Okay, so we give the pills as long as they need it. Okay? So, of course, a patient who comes 29 years old, paano mo, gusto na niya ulit magbuntis, then definitely the pill will be, you know, removed from the medications that she will have to take because mag-iiba na yung direction ng treatment. So, it's important to know what are we trying to address here. So, pills, irregular menses, acne, maganda na siya. I tell them if we have achieved, no, metabolically, that 6 months, have you lost weight? I would consider removing the pills. Because baka okay na eh. Alright? For patients who are so happy with it, they need the contraception as well. Say, take it as long as you don't want to get pregnant yet. Okay, pills for long-term use have been documented to be safe. So I have no issues with giving pills long-term as long as they are monitored by the doctors properly.
I see. And because diba may infertility issues also with that come with PCOS. Okay, so have you encountered also patients na parang okay, sumusuko na, hopeless na talaga, and they would just like opt for IVF?
Okay.
Para mabuntis. And a follow-up question also would be, basically, pagka ba may PCOS, na-affect ba niya yung outcome ng IVF?
Okay. So, but before we go to IVF, I just like to say that not all PCOS patients will need IVF. So, the first thing that we have to address, kung infertility po or hirap po magbuntis ang problema, will be to make sure na nangingitlog po sila. So, the first line will be, I guess, again, lifestyle modification. After that, then we will probably make sure na nangingitlog po ang pasyente. So, we give them ovulation-inducing medication. So, maybe you've heard of clomiphene or letrozole. So, these are very affordable medications taken just 5 days in a cycle. And then we just check, is this working? Then timed intercourse. Now, for some patients, if it's going to work, it should work in about 6 months, okay, generally. And if not, then we start discussing and take into consideration all the other factors which may affect the fertility of a patient. Then we make our recommendations. Are these patients for intrauterine insemination? Or are these patients, if just purely PCOS, should undergo IVF already?
I see. No, we've been mentioning IVF, no, pardon po mga kasangbahay. When you say IVF, that's in vitro fertilization. So basically, sa labas po, kasi di ba ang babae may itlog. Ang problema, kailangan may mature follicle. Yun po yung kinukuha para basically, i-fertilize po ng sperm cell. Okay, sa labas po siya pinapagrow. Okay? And however, dahil pinag-uusapan natin yung PCOS, ang problema nga, ang dami-daming mga itlog na mga walang saysay.
Hindi lumalaki.
Hindi lumalaki.
So,
wala ka ring i-fertilize sa labas. Wala kang basically, wala kang, ano bang appropriate term doon, doktora? Kasi di ba, kung wala ka ring itlog na maha-harvest para wala kang maayos na mature follicle yung babae because having PCOS, di ba kasi yung problema with PCOS, kaya may infertility issue siya. So ngayon, hindi ka rin magkakaroon ng magandang egg para yun ang i-fertilize ng sperm cell.
In a natural cycle, that's the problem. Yeah. Okay, so but when we start considering or doing IVF, we make sure, nagbibigay ho kami ng gamot. We call them gonadotropins. Napakamahal po. Kaya ho mahal ang IVF. Okay? Then we give them shots to make sure all these small follicles will actually grow. And actually for PCOS patients, kapag ginagawa na po namin yung what we call oocyte pick-up or egg collection, dami-dami ho namin nakukuha. Pero sabihin ng pasyente, oh, marami, it's good. But the problem with PCOS patients, even if marami ho sila, hindi ho sila lahat excellent quality.
I see.
Okay, so now you get this whole lot of eggs kasi nag-stimulate ho tayo ng PCOS, then marami na pang po ma-fertilize. So, yun po yun. Ang problem with PCOS patients who are undergoing IVF is that they are at risk for what we call ovarian hyperstimulation syndrome, which is very dangerous. So, maingat po kami pagka nag-IVF po kami ng patients with PCOS.
Okay, so basically talagang very importante talaga yung monitoring ng patient. Okay, and usually what time interval do you request the patient to be coming? Okay, just so para makita nyo kung kamusta yung yung improvement ng patient.
Oh, the first time a patient comes to me, I ask them, especially if I start the patient on pills, I ask them to come back before they finish one pack. Because I want to know if okay ba yung pills sa kanya. Does she have any significant side effects or issues with that pill type, pill brand? Because then, pwede pong pag-usapan, makakala natin humanap ng pill na hiyang sa kanya.
O, hiyangan din, doktora.
Correct,
Okay.
no? So, hindi naman lahat yan for everyone. So, you find something based kung ano po yung nararamdaman niya. Then after that, I ask them to come back in 3 months just to see, is she really okay while taking these medications? And then after that, it will depend kung mag-change po yung kanya magiging plans. Let's say, magpakasal na siya. Sabi niya, doktora, syempre, ayoko na mag-pills kasi gusto ko na magbuntis. Then, of course, they'll have to come sooner. But otherwise, I will ask them to come back every year just to be assessed, just to check if the present treatment is still what she needs at that time.
I see. And the case ng patient natin, kailan nyo siya, how frequent do you ask her to come back?
Oh, I asked her to come back after she sees her neurologist, just to...
For the clearance because of her
Yes, to
migraine.
decide.
What if, God willing, and she will be cleared naman by the neurologist, how would you want to see her? How frequent?
Oh, I'll probably want to see her within a month.
Every month, yeah.
No, 1 month first,
1
just to
month
check,
first.
no? Nag-increase ba yung headaches niya when I start her on pills?
Yeah.
And then I'll probably see her after 3 months again. And then after that, it will be a 6-month or 1-year thing.
So it really depends on our first baka compliance din ng patient. Okay, so
True.
that's one issue also, di ba? And not all patients really follow ng
The expectation is I found in my practice that there are patients who shift doctors, but then they say, so you took pills before? Sabihin nila, yes, doctor, I took it for 3 months, but because my prescription was only 3 months, and I didn't follow up. So the assumption is that you will come back after that, so that decide, is this the medication for you?
Yeah,
is it working?
and not because the prescription is good.
Tapos
Actually,
na.
for 3 months, tapos na siya.
Right.
Okay, you have to, yun ang sinasabi natin, di ba? So basically, meron ka lang prescription na ganyang kadami, but of course, you have to see your doctors pa para mas
Again.
naalagaan kayo, mas natututukan po kayo.
Right.
Okay, and ako, doktora, okay, sige, wrap up natin to. So basically, parang in bullet points, paano yung summary of management sa patient, not really dito sa patient natin, but speaking of PCOS generally.
Okay, so first, determine kung ano ba yung kanyang needs. Ano ba yung complaint niya? So, basically, it will be usually irregular menses, the hyperandrogenism, or the infertility. Because lahat yan medyo iba-iba yung management. And after that, it will be a personalized thing. I will always discuss with patients lifestyle management. Okay, very important yan. Because you're right, that question earlier, tinanong, gaano katagal ka? Forever? Forever ba? No, sabihin ko sa patient, okay, when we achieve our goals, for weight loss, then maybe we can consider removing the pill and check if okay na. Baka nag-reset yan eh. Okay? So, after that, if it's hyperandrogenism, usually it will also be pills, okay? Sometimes we do get referrals from derma and then they are co-managed, okay, to be able to address that. And then also, kung infertility, of course, iba naman yung track yan. We start them with the mga pampaitlog, okay? Ovulation-inducing medications, we start with pills. And then, if not, then we, of course, consider higher level of infertility treatment for these patients.
I see. So, basically, to sum up, talagang just like any other illness, so most likely, we direct talaga yung ating management towards dun sa pinaka-cause.
Yes.
And dun sa pinaka-concern.
Right.
Okay,
and sorry, I forgot to say, of course, kapag may mga underlying problems, if this patient has hypertension, diabetes, okay, dyslipidemia, or mataas pa yung cholesterol, all of these things will also have to be addressed. Because we're worried, okay? So, I kind of look at it as a lifestyle problem, okay? All of these things, in the end, will increase the patient's risk for hypertension, for diabetes in the long run, obstructive sleep apnea, like I said, endometrial cancer. So, the patient really has to be healthy, okay?
Yeah.
The patient has to be healthy. Okay?
So basically, everything it still boils down to the overall health and wellness of the patient. Okay, nako. So nakita na naman natin, mga kasambay, kung gaano kahalaga po na talagang lagi tayong maayos ang estado ng ating kalusugan. Nako, doktora, bago ka tapakawalan, you have like final words for our viewers.
Okay, so listen to your doctors and talk to them. I think it's very important that the goals will be clear so that we may be able to help you the best. Okay? And being honest with us, with your needs, okay? That's the best way we can probably help you.
Thank you, Doctora.
Listen to us.
Yeah. And baka meron kayong gustong batiin and you might want to invite them to visit you here at Makati Medical Center.
Visit our excellent doctors here in Makati Med. Okay, we'll make sure to take care of you.
Ay, so there you have it. Thank you very much once again, Dr. Margaret Joyce Cristi-Limson, an obstetrics and gynecologist from Makati Medical Center. Naku, we hope mga kasambahay, napakarami pong natutunan sa ating tinalakay ngayong araw. Basta dito po sa Doctors on TV, our main objective is to provide health tips that inspire and guide you to a better life. Naku, kaya't wag muna po kayo maglilipat ng channel. Magbabalik po ang Doctors on TV. Nagbabalik ang Doctors on TV. Sana ay marami kayong natutunan ngayong araw. We consistently emphasize prioritizing your health for a good life. At sa lahat po ng may mga pinagdadaanan, lalo na po sa kanilang mga kalusugan, may God bring healing and guidance to each one of you, mga kasangbahay. And with that, we conclude today's enlightening episode. But before we end, take a moment to watch this.
Watch these snippets for the upcoming episode on Sunday.
Osteoporosis po, ang ibig sabihin lang po nun ay isang sakit kung saan ang mga buto po natin ay nagiging marupok. Pag marupok po ito, very prone po para magkaroon ng bali o fracture.
At yan po mga kasambay ang aabangan natin sa susunod na linggo. And as we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their unwavering support. And I would like to greet BMPI's General Manager, Mr. J. Eusebio, at syempre ang ating Kuya Daniel Rason na wala pong sawang sumusuporta sa mga adhikaing public service. May God always protect you and grant you a healthy life. Siyempre, binabati ko din yung aking kambal, si Iyo and Gia, and si EJ also, and hi kay Doc Aline. And of course, yung mga pasyente natin sa Barba-Cabodil Health and Wellness Center. And Nanay and Tatay, I love and miss you both. At sa ating mga kasambahay, naku, maraming salamat po sa patuloy ninyong pagtangkilik sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box, Dr. Sara Barba-Cabodil. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, magandang araw at maraming salamat sa inyong lahat. Ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health, only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart. Located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at Ground Floor Super 8 Warehouse Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Maykawayan City, Bulacan, 0922-861-2095. Asian Breast Center is the premier healthcare facility dedicated to breast health and wellness. It specializes in breast cancer diagnostics, treatments, and disease management, offering state-of-the-art technologies in treatment guided by American standards and guidelines. Visit their Facebook page at facebook.com/Asian Breast Center PH. The Asian Breast Center is located at the 8th floor of Centuria Medical Makati, located in Galayaan Avenue, corner Salamanca Street, Barangay Poblacion, Makati City. The center is open Monday to Friday from 9 a.m. to 4 p.m., except holidays. To get the best level of care, you can book an appointment by calling their mobile number at 0917-127-3278 or send inquiries through email ask.abc@asianbreastcenter.com. Breast cancer is curable and treatments are affordable when detected and diagnosed early. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barba-Cabodil Health and Wellness Center, located at Unit 1531, Centuria Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sara Barba-Cabodil would like to express her gratitude to Medical Depot, healthy num-num food, where we do.